And then nursing care for a child with cancer, anticipatory guidance, of course, for like bandages, hair loss, stuff like that. Coping skills supported, quality of life during treatment maintained, growth and development maintained during treatment. So, managing side effects, um, treatment for chemo, nausea, vomiting is Zofran or dexamethasone, 30 to 60 minutes before and for 24 hours after treatment. And then there's mucosal ulceration in the mouth. So they're going to use soft toothbrushes, soft food, and mouthwash with normal saline. Alopecia, we're going to educate the family that the hair will grow back, but it may have a different texture or color. And then signs and symptoms of cancer in kids, it's often described as vague. Definitely know this stuff. It'll be like pain, fever, skin changes, either ecchymosis or petechiae. Anemia, that's associated with invasion of cancer into the bone, so they'll feel weak and lose weight. They might have an abdominal mass, and definitely don't palpate that. I didn't remember that. Swollen lymph nodes, headache and vomiting. Let's see what else. So, family education. There's something called cancer quackery. It's like procedures, home remedies that aren't proven to help. For example, like essential oils. If it'll make the family feel better and won't cause harm, then they can do it. But it doesn't necessarily like treat the cancer or anything like that. So, health promotion for kids with cancer, dental care, vaccines, of course. So, these are given 2 weeks before during chemo, or vaccines that are given 2 weeks before or during chemo should be considered inactivated. So, we don't want them to get like live viruses during chemo. And they should be revaccinated or receive live virus vaccines 3 months after chemo has stopped. And then, like I said, they shouldn't get any live vaccines like MMR. And then, but the siblings or family can receive live vaccines. Cessation of therapy. So, if the possibility of sterility exists, they could do pre-treatment sperm banking for adolescent boys. So they can use that in the future to have kids. So cancers of the blood and lymph systems, leukemias. So all acute lymphoblastic, or ALL, acute lymphoblastic leukemia, is the most common form of childhood cancer. It's common in white kids younger than 15, more frequent in males older than 1 year, and the peak onset is between 2 and 5 years old. So, leukemia is a broad group of malignant diseases of the bone marrow and lymphatic system. There's ALL and AML. Let's see. So, chromosome studies, kids with trisomy 21 are 20 times greater risk for developing ALL, and then kids with more than 50 chromosomes on the leukemic cells have the best prognosis. So it's an unrestricted proliferation of immature white blood cells in the blood-forming tissues of the body. Liver and spleen are most severely affected, and although it's an overproduction of white blood cells, the acute form often causes low leukocyte count. So they'll be immunosuppressed. And then consequences, anemia from decreased red blood cells, infection from the neutropenia, bleeding tendencies from decreased platelet production, and then the spleen, liver, and lymph glands show marked infiltration, enlargement, and fibrosis. We'll see immature leukocytes, white blood cells, and low blood counts on their labs. Okay, And I remember this for sure, this 3 phases of therapy. So there's induction therapy, that's 4 to 6 weeks, and then there's intensification or consolidation therapy, and that's to eradicate the residual leukemic cells and prevent resistant leukemic clones. And then maintenance is to preserve remission. Signs of chemotoxicity, nausea, vomiting, anorexia, mucosal ulceration, neuropathy, hemorrhagic cystitis, alopecia, mood changes, and moon phase. I do remember that that'd probably be like a good SATA question that they might do. So, lymphomas, I remember these two. There's Hodgkin disease, or Hodgkin's lymphoma. This is more prevalent in 15 to 19-year-olds. And then non Hodgkin's is more prevalent in kids younger than 14. So make sure you like have those straight in your brain. And then clinical staging of Hodgkin disease, stage A, they're asymptomatic, and then stage B, they'll have like a fever, night sweats, weight loss of 10% or more over previous 6 months. And then the purpose of staging is to help us know the extent of the disease at the time of the diagnosis. Let's see. So, nervous system tumors, brain tumors are the most common solid tumors in kids, and 60% of them are infratentorial. They occur in the posterior third of the brain and primarily in the cerebellum or brainstem. Manifestations will have an increased head circumference, obviously, headache, and symptoms associated with elevated ICP. There's a table. I would probably look at that. I don't remember what it is, but probably important. And then they'll do an MRI, CT, EEG, and LP. Neuroblastoma, I do remember a lot of this. So this is the most common malignant extracranial solid tumor of childhood. The majority of tumors develop in the adrenal gland or the retroperitoneal sympathetic chain. Common signs, symptoms, know these: firm, non-tender, irregular mass in the abdomen that crosses the midline. And she drew a little picture here of that. So she drew a little arrow here because it develops in the adrenal gland. Catecholamines will be present in the urine. I feel like I remember something about that. For neuroblastoma prognosis, in general, younger age at diagnosis equals better prognosis. That kind of goes for anything because they can like proliferate stuff. Bone tumors rule out trauma or infection first. Osteogenic sarcoma, peak incidence is 10 to 25 years. Most primary tumor sites are in the metaphysis of long bones, especially the legs, and then more than 50% occur in the distal femur. There's body image concerns, issues of adolescence, like maybe if they have to get an amputation. There's Ewing sarcoma, that arises in the marrow. So I remember a lot of this mainly. So the Wilms tumor, this is also a nephroblastoma. It does not cross the midline, know that part for sure. Malignant renal and intra-abdominal tumor. Again, it doesn't cross the midline. It's 3 times more common in African American kids. Peak age is 2 to 3, more frequent in males. Rhabdomyosarcoma, let's see. I don't really remember that one that much, honestly. Okay. Retinoblastoma, this is, it arises from the retina. I remember this. The cat's eye reflex, this is the most common sign, and it'll be like a whitish glow of the pupil, and then strabismus is the second most common sign. They'll have a red painful eye, often with glaucoma, and then blindness is a late sign. The tumor may spontaneously regress. So testicular tumors, these are not common, but those appearing in adolescence are generally malignant, And then this is the most common form of cancer in males, 15 to 44 years. Okay, not much on that one. So, child with cerebral dysfunction. Any questions on the last one? No? Okay. So development of the neurosystem, brain growth is reflected in head circumference. That's why we measure that. And then cerebral blood flow and oxygen consumption is twice that of adults. So increased ICP in infants, they're going to be irritable, poor feeding, high pitched cry, difficult to soothe, bulging fontanelles, and separated cranial sutures. In kids, they'll have headache, nausea, vomiting, visual disturbances, and seizures. And then we want to minimize interventions that cause crying because crying increases ICP. And then do not keep the head of bed flat or like Trendelenburg, then that would be bad. And then minimal suctioning. So altered level of consciousness is the earliest indicator of neurologic status change. I don't remember any of those. So head injury, this is unintentional injury, and it's a number one health risk for children and leading cause of death in kids over 1 year. So this would be like falls, car crashes, bike injuries. It's important they wear helmets. Nursing care, bed rest with the head of bed slightly elevated and head in midline position. Submersion injuries, this is the highest mortality in kids 0 to 4 years. The clinical manifestations are based on the water temperature, length of submersion, and type of water. So infections, meningitis. Most kids will have a sudden onset of headache, fever, vomiting, and severe headache with irritability. Babies may have fever or hypothermia, poor feeding, and bulging fontanelle. So, of course, they're going to be on isolation. We'll do a lumbar puncture, IV fluids and nourishment, limit stimulation, and give meds. Let's see. So, upper motor neuron lesions, they'll have weakness and spasticity, increased reflexes, and abnormal superficial reflexes. And this is primarily cerebral palsy. And then lower motor neuron lesions, they'll have weakness, atrophy of skeletal muscles, hypotonia. This is usually symmetric. And then there's a gradual or sudden onset, sudden onset of this indicates causation. Seizures, epilepsy is 2 or more unprovoked seizures. I feel like I remember like maybe a little bit about these. Let's see, what is this? Seizure types. I don't really remember this being super important. So status epilepticus is a seizure lasting longer than 30 minutes. Of course, we want to maintain a patent airway. First line is Ativan or diazepam. And then nutritional support with vitamin D and folic acid. Migraines, this is pounding or throbbing head pain. In kids, it's usually in the front or both sides of the heads. And then in teens and adults, it may affect one side of the head. So cerebral malformation, hydrocephalus, this is a buildup of fluid in the brain ventricles, and they'll do a VP shunt for this. And with this, we're going to reassess the growth of the child. Okay, cool. And y'all can go over those. Margaret, are you there? Unless you want me to do these, I can do them.
I'm still in the car.
Okay, you're good.
I still have like 23 minutes till I get home.
Okay,
Sorry.
You're fine. No, you're fine. So, musculoskeletal or articular dysfunction. Honestly, like, I don't even know if I remember a lot of this. Let's see. Okay, so physiologic effects of immobilization. Skeletal, they might have bone demineralization and a negative calcium balance. Renal, they might have hypercalcemia, so they're at risk for kidney stones. Decreased metabolic rate, decreased production of stress hormones. They're going to have an increased workload of the heart because they're like flat laying in bed. Thrombus formation, obviously, that's not just specific to kids. They might have loss of innervation, so if nerve tissue is damaged by pressure or if circulation to nerve tissue is interrupted. Yeah, I don't think there was a ton of. Okay, I do remember this. Cast care. She put here that the cast cutter tickles. Kind of looks like a saw, but it doesn't hurt the kid. So when we're putting the cast on, we're going to allow the material to thoroughly dry. Do not apply heated fans or dryers because of the heat conduction. Turn every 2 hours, assess for edema. We're going to keep the casted extremity elevated to relieve edema. And use palms of hands when handling cast to avoid indenting. So we're not going to use like fingers. I do remember that. Assess distal movement and circulation. Remember the 5 Ps. And then teach them to monitor hotspots. That could be infection, any foul smells, bleeding, excessive edema, pain. And then don't introduce any foreign objects into the cast, like a hanger or something to itch it. Don't put anything in there. The child interaction. So here too, remember that this is never touched or released by us unless it's an emergency. Sorry, my phone's being weird. Unless it's an emergency or under direct supervision of the provider. Pin site care. Mobilization devices, there's orthotics, which are braces, and prosthetics, artificial limbs. They need to have clothing under braces, and then frequent assessment of the brace and skin every 2 to 4 hours. Fractures, epiphyseal injuries. So this is the weakest point of weakest point of the long bones is the cartilage growth plate or the epiphyseal plate. The clavicle is the most frequently broken bone in kids, especially under 10, school age. This could be from like bike or sports injuries. So types of fractures, I do remember these. They're pretty easy to remember. So complicated. Bone fragments have damaged other organs or tissues. That's pretty bad. Simple or closed. This is a complete break without producing a break in the skin. And then open or compound would be complete break with a bone protruding through an open wound. So that's breaking the skin. Transverse, you can see that right there. Oblique and spiral, kind of like twisted. Comminuted, this is small fragments of the bone are broken from the fractured shaft and lie in surrounding tissue. And then green stick, the compressed side of the bone bends, but tension side of the bone breaks, and it's an incomplete fracture. It just kind of like bends. So common fractures, there's a bend, kind of like the green stick, but I guess it's called this. Because kids' bones are flexible, the bone is bent but not broken, and it'll heal on its own, but they might have some sort of deformity, like one leg is a little bit longer than the other, something like that, or shorter. Buckle, this is compression of a porous bone, and it looks raised or like a bulging projection. Talked about green stick. There's typically rapid healing in kids. Five Ps, I was talking about this earlier. So pain, pulse, pallor, paresthesia, and paralysis. And then she put next to paresthesia, this is an ominous or late sign. And remember, they can get compartment syndrome, which that is bad. Dislocations. Let's see. So pain increases with active or passive movement. Hip dislocation, there's potential loss of blood supply to the head of the femur. And the most common is the nursemaid's elbow. I don't really remember that, but maybe it'll be on there. I do remember this. Rice, rest, ice, compression, and elevation. Ice, max 30 minutes at a time. There's also ices, ice compression, elevation support. Stress fractures. The tibial fracture is most common. There's going to be pain over the bone itself. That's the most significant symptom. Management, rest, lots of rest, and then not bed rest, but like alternative exercises. I do remember this part for sure. Exercise-induced heat stress. So there's heat cramps, leg muscles, sweating profusely. They're going to rest and replenish fluids. There's heat exhaustion, thirst, headache, fatigue, dizziness, anxiety, nausea and vomiting. And disorientation. We're going to move them to a cool environment, rest and fluid replacement, and then heat stroke. This is rapid onset, headache, weakness, disorientation, loss of consciousness. They're going to need rapid cooling, O2, fluid replacement, and a detailed assessment. Maybe I don't remember that as much as I thought I did. Energy drinks increase risk for dehydration. They need iron supplements. I definitely remember this. So the female athlete triad, it'll be amenorrhea, no periods, osteoporosis, so because of the lower estrogen levels and poor diet, and then eating disorders. Definitely remember that. And she put here, they can still get pregnant and they still need birth control. So definitely look over that, remember that. Sudden death, I don't really remember this. There might be unrecognized underlying medical problems like idiopathic hypertrophic subaortic stenosis. I don't remember that a whole lot, I don't think. Maybe just look over that. Torticollis, this is in babies. Wry neck. It's congenital or acquired limited neck motion, and the neck is flexed to an affected side, so like their head is kind of tilted. And we're going to do stretching exercises or like physical therapy. You can see that right there. Kyphosis is a hunchback. Can result from TB, arthritis, compression fracture, lordosis. There's like a curve in the cervical or lumbar region. And scoliosis. This is the most common spinal deformity. This is pretty common in like adolescence. There's lateral curvature. The spinal rotation might cause rib asymmetry, and then there's thoracic hypokyphosis. Might be congenital, or they might develop it during childhood, and it generally becomes noticeable after pre-adolescent growth spurt. And they might have a complaint of ill-fitting clothes. I feel like I maybe will know that. So skeletal limb deficiency. This is underdevelopment of the extremities. Don't really remember anything about that at all. I do remember this, but it might be from OB, but I would still know this. This is hip instability after birth, and there's a high association with breech delivery, which makes sense. They're like folded up there in the uterus. So the Ortolani and the Barlow tests. So the Ortolani, they're going to do abduction and then push the thigh this way. And then the Barlow, bringing the thighs towards the midline, adducting the hip. So the Ortolani, you're going to bring them apart and then like push it down, I think. And then the Barlow would be like pushing, like taking both of the thighs equally and like pushing them up. In older kids, they might have a limb or a leg discrepancy, like one is shorter than the other. Pavlik harness, that's usually what they use for that. This does not look common to me. Or, like, I do not recognize this at all. This leg calf Hertz disease. I really do not remember. Oh, okay. I remember this part. Avascular necrosis of femoral head. That's, like, really the only thing I remember. I don't remember this. But it's spontaneous displacement of the proximal femoral epiphysis. Yeah, I don't remember that. Goal is to keep head of femur in place, basically. So, osteomyelitis, they're going to be getting IV antibiotics. This is infection of bony tissue, can be from different sources. So, the symptoms begin abruptly and they resemble symptoms of arthritis and leukemia. They're going to have marked leukocytosis, exogenous osteomyelitis, so the infectious agent invades the bone following penetrating wound, open fracture, contamination and surgery, secondary extension from an abscess or burn, and then, so this is like an outside infectious agent. And then there's the hematogenous osteomyelitis. I am like having the hardest time pronouncing this stuff today. So this is where a pre-existing infection spreads to the bone. So this could be like from furnicles, skin infections, URI, abscessed teeth, pylo. Any organism can cause osteomyelitis. Like I said, IV antibiotics for an extended period. Monitor those responses. Septic arthritis. I really don't remember anything about that. Okay, I think I do kind of remember this stuff. Osteogenesis imperfecta, or OI. This is a group of disorders of the connective tissue. They're going to have excessive fragility and bone defects, and hyperextensibility of ligaments. So type 1A, mild bone fragility, blue sclera, normal teeth, and presenile deafness. B, same as A except with abnormal dentition. And then C is the same as B, but no bone fragility. So they're going to have blue sclera, abnormal dentition, and deafness. And then they're all kind of similar, but yeah. Type 2 is lethal. They're either stillborn or die in early infancy, and this is severe bone fragility with multiple fractures at birth. Type 3, this is severe bone fragility and it leads to severe progressive deformities. They'll have normal sclera, but marked growth failure. And then type 4A, normal sclera, short stature. And then B, same as A, except they have abnormal dentition. I'm trying to remember what was important with this.
I remember spending a lot of time freaking out over like memorizing each thing, and there was not really a lot of questions about it. So
yeah, but
that was for us. So it may be different for y'all, but I would like know it, but don't freak out about like memorizing every detail of it.
Yeah, that's what I think too. Like, don't get super stressed about like all the subtypes and weird stuff like that. Therapeutic management, they're going to do biphosphonate therapy. Okay, let's see. I feel like the stuff I do remember is from our tutoring. Like, I honestly don't really remember this test because it was so traumatic. Not saying it'll be like that for y'all, but
yeah, this test was a mess.
This was the first test where I literally like was randomly like answering random stuff, like mainly the PSA questions. But it was so bad. It was so
Molly walked out of the test and just started yelling.
It was so horrific. It was so bad. Yeah. Anyway. So juvenile idiopathic arthritis. I remember studying this, but it wasn't on the test. Yeah. I don't really remember anything from this. I think I remember it, like, if I remember anything, it might have been the manifestations. It's basically just arthritis. Um, yeah. I'm not even gonna, like, read over that because I don't remember that. Yeah. Okay, I remember the DMARDs. I remember that that's used for the JRA. I do remember that. Lupus. This is more common in females, 10 to 19, more common in African American, Asian, and Hispanic kids. Familial tendency, we don't know what caused it. Yeah, I would probably know this. Criteria, butterfly rash, discoid rash, photosensitivity, renal disorder. They must have 4 of those. And then they're going to do anti-inflammatory and immunosuppressive agents for that. Okay. Any questions? We're almost done. This is the last chapter. And then we'll look over the hesi stuff. Okay, so cerebral palsy. This is characterized by early onset and impaired movement and posture. This is the most common permanent physical disability in childhood, and it's commonly caused by neonatal encephalopathy. There's different types. Maybe look over that box. So spastic is the most common clinical type, and it presents as hypotonia. And then ataxic, wide base gait, and poor performance of rapid repetitive movements. So like jerky coriform movement. So, okay, I do remember this for sure. I definitely do. Possible motor signs, poor head control after 3 months, stiff or rigid limbs, arching back or pushing away, floppy tone, remember they're hypotonic, unable to sit with support at age 8 months, and then clenched fist after 3 months. Possible behavioral signs, excessive irritability, no smiling by 3 months, and feeding difficulties. They might have persistent tongue thrusting, frequent gagging, or choking with feeds. I feel like I remember these mainly. About half of them have a normal IQ. Goals are to, okay, I do remember this. Establish locomotion, communication, and self help. We want to give them the best quality of life as possible. Botox, baclofen, dantrolene, and diazepam or Valium. So defects of neural tube closure, anencephaly. This is where the head is not fully formed. This is the most serious neural tube defect. This is incompatible with life. They basically don't have a brain. Many are stillborn, so we'll do comfort measures, but there's not going to be any resuscitation efforts. Spina bifida. So I do remember these different types. So there's occulta. This is not visible externally, and then there's cystica. This is visible with an external sac-like protrusion. So, and then this is where, or like the subcategories of cystica is myelomeningocele and meningocele. So meningocele has the spinal sac covered by the skin, and then myelomeningocele is the spinal sac is not covered by skin. And this has the meninges and spinal cord, so this one is pretty bad. So this occurs during the first 28 days of pregnancy. This is the reason folic acid needs to be taken early in pregnancy, and usually, like, they'll tell people that are trying to get pregnant to take it before, because a lot of people don't even know they're pregnant during the first 28 days. incidents higher in girls and Hispanic kids. So they'll have urine dribbling or overflow incontinence, or anal sphincter tone and orthopedic deformities. I mean, you're obviously going to see this. Like, it's a sac with the spinal cord and meninges. They're going to be prone, obviously. We can't have them laying on that. Let's see. Okay, so hypotonia floppy infant syndrome. Don't really remember that. Sorry, I feel like this is so unhelpful. I'm like, don't remember that. My brain has just like thrown it out the window. Okay, Julian Bear, I would know this part. Paralysis occurs approximately 10 days after non-specific viral illness. Occurrence in kids is most often when they're 4 to 10. So in most, muscle function begins to return 2 days to 2 weeks after onset. And then most of the deaths are due to respiratory failure, because this is just like a lot of like motor and muscle weakness. Like I said, this is associated with viral or bacterial infection, or very rarely administration of vaccines. And then the CSF may have increased protein, and then other labs will be normal. Do I remember this? I feel like I remember studying for this, and then it wasn't on the test, but like it might be on y'all's, so I would look over it. So initially they'll have muscle tenderness, paresthesia, and muscle weakness. Paralysis will rapidly ascend from lower extremities, so like it'll move from the legs up to the top. That's why it's important we manage this, because it will like end in them not being able to breathe. They'll have flaccid paralysis and loss of reflexes, intercostal and phrenic nerve involvement, breathing issues or lack of breathing. They'll frequently have urinary incontinence or retention and constipation. Makes sense. It's not working. Tetanus, aka lockjaw, muscle rigidity of the masseter and neck muscles. So the bacteria enters the body through a wound, especially a puncture or a crush wound or burn. It's not necessarily like from a rusty nail. Like, I don't know where that came from, but it's basically like any infection, like anything that's like dirty and it like gets in a wound, basically. So like a scratch, bee sting, thorn, or needle prick. So requirements. See, like this is all highlighted, but I don't remember this. But there's presence of tetanus spores or vegetative forms of the bacillus, injury to the tissue, so penetrating wound or laceration, and a susceptible host. So someone who hasn't been vaccinated, that's why it's important we get them a vaccine. So initially, there's going to be progressive stiffness and tenderness of the neck and jaw muscles, difficulty opening the mouth, and facial muscle spasm. So botulism, I do remember this. So this is food poisoning resulting from ingestion of botulinum toxin. So sources in the older child, it could be from improperly sterilized home canned foods. And then infant, y'all have probably heard this, they can't have honey, and light or dark corn syrup. So CNS symptoms appear abruptly 12 to 36 hours after ingestion. They're going to have weakness, dizziness, headache, diplopia, speech difficulties, vomiting, and then there's going to be progressive life-threatening respiratory paralysis. So obviously they're going to need respiratory support. And then there's the BIGIV, that's IV botulism immune globulin, and then to treat infants. And then she put like baby pig. So constipation is often the presenting symptom in babies. kind of the same stuff. Generalized weakness, decreased movement, diminished DTRs, loss of head control, feeding difficulty, weak cry, diminished gag reflexes, hypotonia. And we're not going to treat them with the antitoxin. They're going to get the immune globulin, the BIGIV. Myasthenia gravis is usually, or it's pretty uncommon. Not even gonna really go over that. Prostigmine or neostigmine. Spinal cord injury. Tetraplegia is lacking functional use of all four extremities. That was formerly called quadriplegia, and tetra, like Tetris 4. Autonomic dysreflexia, y'all probably have heard a lot about this already. The typical cause is bladder distension, and this is a life-threatening complication of spinal injury. So they'll have like hypertension, headache, bradycardia, they're going to be sweating a lot, dysrhythmias, flushing, piloerection, like hairs standing up, blurred vision, nasal congestion, anxiety, and visual spots. We need to remove the offending cause, so like straight calf, see if they need to like poop, stuff like that. IV antihypertensive meds and antispasmodic meds. So muscular dysfunction or muscular dystrophies, this is the largest group of muscular diseases in kids. They all have a genetic origin with gradual degeneration. Duchenne muscular dystrophy or DMD. This is also called pseudo hypertrophic muscular dystrophy. It's the most severe and most common. I do remember this. Progressive muscle weakness, wasting, and contractures. And then the calf muscle hypertrophy in most patients. So they'll have a waddling gait, frequent falls, and the Gower sign. This is when they use their hands and arms to walk up their own body to get from squatting position to standing, and this is due to lack of hip and thigh muscle strength. They'll have lordosis, muscular atrophy in later stages, and then mental deficiency is common. Okay, that's it for that. Oh yeah, I love her Quizlets. Dylan Brinkman, definitely look over those. Those are pretty good. Okay, any questions? I know I went over that quickly, but I don't know. I feel like there just wasn't a lot to it.
Well, and for us, like half of our questions were PSA questions, so
yeah, that's true.
There's that.
Very true. What time is it? It's like not even 9, is it? Yeah.
Yeah, way to go. Thanks for doing literally everything so far. I just got home.
You're fine. Do you want to do the hesi, or I can do it?
Yeah, I can do it. Let me just like log on my computer.
Okay. Can you share on your computer?
Probably.
Okay.
Yes.
Because I really have to go to the bathroom.
Okay, I'm also going to turn off my camera really fast because my compression socks are hurting my calves. So I'm going to change really fast.
Okay, we'll be right back, y'all.
You're silly.
Okay.
Sorry, y'all. Today has been kind of a mess. Thanks for hanging in there with us. Let me get this pulled up real quick and then we'll do hesi stuff.
Oh no.
Okay. Sorry, y'all, my computer hates WebEx. I think I've told you this like literally every single time that we do this, but it's taking forever.
Mommy, look.
Also, please excuse my unmade bed in the background.
Sorry. Oh, okay. Hi. Sorry. I was going to the bathroom. Okay, I was gonna use, Madison's, it says, like, Peds Hesi with doodles.
Okay. My computer is being extraordinarily slow because it hates
I
WebEx.
can share.
Okay. It just, anytime I turn WebEx on, my computer slows down by like 100%.
No,
So annoying. Okay, perfect. Okay, so PD Hesi, I'll just say y'all are really well prepared for this. So, like, y'all are going to be fine. Definitely go over the key developmental milestones. So know like what month things happen. Know your what's it called? Erickson's stages of development. But so the child sits unsupported, that's 8 months. Throws the ball overhead, that's 18 months. 50% of adult height in 2 years, can speak 2 to 3 word sentences in 2 years, and then uses scissors and ties their own shoes. Those are 4 and 5 years. For those of you who have kids or like have nieces and nephews that are like going through these stages, don't compare what's happening in real life with the correct answer on the test. So make sure that you know like what the book says or what the lectures have said about these timelines because they're different in real life. And then just know, like, I honestly don't remember a ton of questions about like these trust versus mistrust, all these things, but just kind of know, just look over them. Yeah, I wouldn't say there's like a ton of them. I would say like trust versus mistrust and maybe like industry versus inferiority were like the big ones that I remember, but yeah. Okay, so birth to 1 year, we have our birth weight. It doubles in 6 months and then triples in 12 months. So know those for sure. Our birth length increases by 50% at 12 months. So if they were, 20 inches at birth, they'll be 40, by 50%. So 50% of 20, so they'll be 30 by 12 months, right? Okay. Been a long day. The posterior fontanelle closes at 8 weeks. They'll start having that social smile at 2 months, and they'll turn their head to sound at 3 months. The Moro reflex, remember that's like the startle reflex, will disappear at 4 months, and they'll have more head control at 4 months. The big ones that I would say remember are those bottom 4, the head control at 4 months, the rolls from abdomen to back at 5, and then back to abdomen at 6. So she has that nice little acronym, the ABBA, ABBA. So the first A to B is 5, and the B to A is 6 months, not years. And then they'll play peekaboo at 6 months as well. I remember that one being really important, and I don't remember if it was for the HESI or for one of our unit tests, but know that one. They'll transfer objects in each hand at 7 months. They'll have that stranger danger, anxiety between 7 to 9 months. At 8 months, they'll sit unsupported. That one's a big one. And then remember crawls, creeps versus crawls. Remember that as well. But they'll crawl by 10 months. So they'll walk with assistance by 10 to 12 months. So that seems pretty standard, although other ones will do it earlier. And then explores their environment by motor and oral means. Remember, they like put literally everything in their mouth. It's disgusting. Kids are weird. Yeah, so know that. Okay, 1 to 3 years. So their birth weight will quadruple at 30 months, so 2.5 years, which whenever I see that 30 months, I always think of the moms that are like, yeah, my baby is like 427 months old. Like, no, ma'am, stop. They'll achieve 50% of their adult height in 2 years, and then their growth will start to slow. So they'll like have these big growth spurts, but then it'll kind of start to slow. Remember, toddlers look bow-legged and they're kind of pot-bellied. They'll start having all their primary teeth. That anterior fontanelle will close between 12 and 18 months. And then they'll throw a ball overhead at 18 months. We kind of already talked about that. Kick the ball at 2 years. Feed themselves with their spoon in a cup at 2. And you'll want to kind of start potty training around 2 years old, but just depends on when they're ready. They'll speak 2 to 3 word sentences at 2 and 3 to 4 word sentences at 3. And then remember, this is a stage where temper tantrums are really common, but they should start to like taper off after this stage. And it's really important to be consistent with discipline and to give choices because they love the word no. So they'll just say no all the time. So if you give them 2 choices, let them have like a sliver of control. That'll be good. Okay, so this little drawing was actually really helpful. So I would like spend some time looking at it. So like it says, you want to know the normals so you can identify the abnormals, but yeah, just take a look at this. I would, study it, look over it. It was helpful. Yeah. Okay, so the preschooler, which is 3 to 6 years, they'll gain 5 pounds, and 2.5 to 3 inches each year. They'll stand more erect and they'll be more slender. So a tricycle has 3 wheels, so at 3 years they'll learn how to ride a tricycle. At 4 they'll use scissors, which honestly just sounds really young to me to have like children running around with scissors, but that's it. At 4 years old they start using scissors, and then they're able to tie their shoes at 5. So their vision is getting better, so they'll start approaching 20/20. And anyone who spent any time with a preschooler knows they're egocentric, like they think about themselves all the time. Their thinking is very concrete, not really abstract. And the length of sentences lengthens to 5 to 8 words. They learn about sexual identity and they become like curious about masturbation. And those are just like common questions that they may have. They have imaginary playmates and they have a lot of fears because remember they have that magical thinking. So yeah. They may be aggressive at 4, independent at 5. I'd say look at the highlighted ones for sure. Okay, 6 to 12, school age. They'll gain 4 to 6 pounds and 2 inches a year. I would say, I can't remember if it was for the unit test or for the hesi, but I would definitely know like those pound ranges and then like how much they grow each year. Okay, they'll lose some of their primary teeth. They'll be more mature in their fine and gross motor skills. They can dress themselves. So they become more aware of like their social surroundings. So socialization is important for these kids, and they'll need more support from their family than they're willing to admit because that's their main support system in this age. Especially those 12-year-olds, they don't like to admit that they need family. Okay, so 12 to 19, we have our adolescents. The girls will finish growing sooner than the boys. So they'll finish at 15 and then boys will finish at 17. Their secondary sex characteristics will start to develop. Is it like the Tanner scale or the Tanner, like the different
Tanner stages?
Yeah, Tanner stages. I would definitely look over those because I remember there being questions on the Tanner stages. Oh, it says it right there, Tanner stage. Okay, good job, Marg. Yeah, so look over those. And then They start thinking more like adult when they're 15, and remember, like, their peers are their most important, like, influence, and body image is super, super important to them. They think that everyone's watching them. They think that they're invincible. They'll think, they'll hear about a story and think, oh, that'll never happen to me. Yeah, that is important for this age group. Okay, so moving on to lymphatic system, immune, heme. So remember the hemophilia, they're at risk for bleeding. They want to pad the sides of their bed so they like don't have any or decrease their risk for injury. And then if they fall and hurt their extremity, we want to apply ice because it's a vasoconstrictor, and then we want to compress it because it'll help stop the bleed. Leukemia, we just talked about that, can cause low white blood cells. They're immunocompromised. Avoid buffets and salad bars. That is very specific, but just think like, people's hands in things and then you eat it. Ew. Mouth sores can be common with chemo, so we want to rinse with normal saline and a soft sponge toothbrush because we don't want to add like any, like irritation to the gums. Sickle cell, keep them hydrated at all costs. Like if there's a question about sickle cell, and then there's an answer choice that says give them fluids, like that is probably the answer. So, yes. So I think there was a question that was like, a guy is having a kid is having a sickle cell crisis, or was diagnosed with sickle cell, and he comes in after like playing out on the playground for an hour. What's the most important thing? Like give him fluids or something like that. Okay, nosebleeds, pinch the nose and lean forward, not backwards. And you can always ask for vaccination status. If they need a tonsillectomy, you're going to assess the oropharynx for edema and bleeding. And if they're like constantly swallowing, I remember that being like an important detail, that they could be bleeding. So just like assess for their swallowing. And then remember, lymph nodes are really important in PD patients. Musculoskeletal integumentary. So we just talked about this osteomyelitis, that bone infection, and it can spread. We'll treat with long-term antibiotics. A good snack would be a milkshake for them because it is like high in calories and they need like a lot of calories. Muscular dystrophy can be assessed with an EMG. Juvenile arthritis, they need around-the-clock pain management. We don't want to have any breakthrough pain for these kids. Atopic dermatitis, this is commonly seen with asthma or hay fever. And then remember, like if you have a patient who's wearing a diaper, we don't want to leave those wet or dirty diapers on because it can cause skin breakdown. And then it'll cause them to cry, and then they won't sleep. It's just a whole vicious cycle. Chickenpox, the child is contagious a day before the rash appears, and then until the vesicles are crusted over, which, ew. Remember to be culturally competent always. So if there is like, the round marks, there's like coining, cupping, that may just be their culture. So don't automatically assume the worst. And yeah, I think that's all. Okay, cardiac and respiratory, RSV, super common. The Synagus vaccine helps to prevent it. Oh, my foot's asleep. Sorry, y'all. And RSV is like now even more common, like out of season. So there's that little tidbit for you. Croup is that barking cough. So remember, like if they are coughing uncontrollably, you may just put them in the bathtub with hot water coming in, like not too hot, or put them in the bathroom and turn on the shower, and the steam will help kind of clear that out. Don't forget the tetralogy of Fallot, however you want to say it. So there's that VSD, pulmonary stenosis, right ventricle hypertrophy, and overriding aorta. There was definitely a question. I got that wrong, so don't be like me. Be like someone who got it right. Kawasaki disease, we want to decrease their environmental stimuli. ABGs, always, always, always remember ABGs. And then chest physiotherapy for CF, we want to do that before meals and at bedtime. And then our nervous system, remember for seizures, don't put anything in the mouth. Never put anything in the mouth. Put bed rails or pad rails pad the rails, and just like make sure that they are safe, monitor the time. For meningitis, I actually had a baby, and she was one of my patients the other day. She had meningitis. She was like 10 days old. It's so sad. But they will have headache, sensitivity to life, that nuchal rigidity, a decrease in feeding and abnormal behavior. That's what was happening with her. So bacterial meningitis could cause ear infections, and then they'll get a lumbar puncture. So we want to put them in a side-lying fetal position to perform that. And then kids with spina bifida, we just talked about this. They often have a latex allergy. Autism spectrum disorder, they may not make eye contact. They have delayed speech or odd repetitive behaviors. Like one of my friend's kids has autism, and he does a lot of like flapping with his hands. And he also likes to scream very loudly. ADHD needs to be evaluated by a psychiatrist, and psychologists cannot prescribe meds, but psychiatrists can. Endocrine, so remember hypoglycemia, they're going to be cold and clammy, get the girl some candy. They may be sweaty, diaphoresis, they could also have a change in their behavior. And then hyperglycemia, remember it's the opposite, so they're going to be hot and dry. Hypothyroidism, everything slows down. So, and we give them levothyroxine for that one, and remember they take that like before the other meds in the morning. And then hyper or Graves' disease, it's an increase in everything. So your increase in heart rate, increase in breathing. So they'll be prescribed a beta blocker just to kind of like slow everything down. Type 1 diabetes, they can use a pump. And then, yeah, that's all I remember from that. Urinary, reproductive, digestive system. So remember, we don't want to make sex like a taboo topic. So it's completely normal. If you have a teenage patient inquiring about birth control, we want to provide them with education and then the risks and benefits. So basic hygiene when it comes to periods or vaginal issues. So remember, to prevent yeast infections, we want to wear cotton underwear, wipe from front to back. Don't sit in wet or sweaty clothing, so like bathing suits, or if they work out, we want to make sure that they're like changing their clothes after that. No bubble baths, UTIs. We don't want to hold our pee in. We want to monitor the smell of urine because that can be a first sign that there's something amiss. And remember, we want to teach girls not to leave their tampons in for over 3 to 4 hours because that risk of toxic shock syndrome, TSS, and always wash their hands. HPV, remember that can be prevented with the Gardasil vaccine or barrier methods. And once the child is 18, their medical information cannot be given to the parents without their consent because they're officially adults. And then again, ABGs. Remember the ABGs. Vital signs. So remember the order of vitals for children. So we'll do their respiratory rate, then their heart rate, blood pressure, and then temp will be last. Because I think it's like the least invasive. Man, babies hate those temp probes being put underneath their armpits. They hate it so much. So as they get older, their heart rate will decrease and their blood pressure will increase. And an increase in heart rate can clue you into dehydration because remember, if they're hypovolemic, they'll be working harder to circulate the small amount of blood. It's also affected by electrolyte imbalances. It can also be affected by pain. So if they're in a lot of pain, you may see an increase in heart rate as well. Which is the next point. Respiration and heart rate increase can indicate pain, so we'll want to give those PRN pain meds because we don't want anyone to be in pain. Remember, don't use the rectal temp because of perforation. Atraumatic care is really important, so we want to do like what is best for the child. So if they are sitting on their parents' laps and we need to take vitals, like let them stay on their lap to take vitals. Oh yeah, if there's ever like a reaction to something, like you start a med through an IV and there's a reaction, always the first thing is stop the infusion. Even before you like check vitals or touch the kid, like always turn off the infusion first. Okay, so math questions. There will be math. but y'all should be well prepared from all of the math questions that you've had on all of your tests in all of nursing school. So just remember about 1 kilogram is 2.2 pounds, a gram is 1,000 milligrams, and then 1 milligram is 1,000 micrograms. So that one, the micrograms kind of stumped some people, so don't forget that one. And yeah, these are in Madison's notes, like in her folder, so those Kahoots are linked there, so you can practice them. Also, I think it was on the other the other presentation, but Dylan Brinkman has really great Quizlets. Like really great Quizlets. Wink, wink. Do them.
Yes.
But yes, and she wrote this for us, but we feel the same about you guys. It's been really fun tutoring you guys.
Yeah, any questions at all?
Y'all are gonna do great. And I really hope exam 6 is everything it was not for us. It was just a mess. If y'all don't have any questions, y'all are free to go. Not that you were ever not free to go, but you know. We love you guys. Good luck.
Yes, good luck.
Let us know how you do.
No problem, you guys.
And I'll see y'all on Friday with Molly for High Acuity tutoring. Our last tutoring ever.